Hello everyone, my name is Bailey and today I'm representing the American Medical Association group and this is our challenge 4. So challenge 4, what are the politics? And in my group it's me, Benjamin, Beth, Hannah, and Megan. So policy number 1, Physician Methadone Prescription Act. So what's the debate? So physicians in primary care settings should be able to prescribe methadone, which will increase access to opioid use disorder treatment. Methadone is an opioid, but it's a less addictive opioid that doesn't have the euphoric, properties that people say that you would feel high. So it kind of helps them get over that addiction without giving them the euphoric effects. Which populations does it affect? This policy affects those struggling with opioid addictions because methadone is used to treat opioid addictions, but also the physicians and pharmacies that will prescribe and dispense them. So who is it against? Who stands to gain from it and who stands to lose? Methadone, being a strong opioid, still imposes risks to some. So some view the drug should have strict regulations. But that being said, some also see this drug as having greater rewards over risks and could really help the opioid addiction population. Those stand to lose are perhaps the ones that fund insurance and Medicare and Medicaid. So where's the lobbying strength? Lobbying strength lies with pharma, as they have the most influence over opioids and the controversial issues and political climate. And we found that there's not much controversy other than the fact that this act will need funding. And as far as the political climate, Democrats seem slightly more concerned about the opioid use disorder treatment. Policy number 2, restrict opioid prescriptions for non-chronic patients. Sorry, kind of got crooked there. So what's the debate? There is an abuse in opioid prescriptions with providers overprescribing them when not deemed necessary. And which population does this policy affect? It affects the population seeking opioid prescriptions for pain relief, specifically those who are deemed to have non-chronic conditions. This policy could also negatively affect those who do not quite meet the restrictions but still could benefit from the drug. Who's against it? Who stands to gain from it, and who stands to lose? So those who are against this policy would also stand to lose are those who have special circumstances and are unable to get the prescriptions they need. Those who stand to gain from it would be the chronic patients that need strong pain relief. Where is the lobbying strength? The lobbying strength lies with pharma, as they have the most influence over opioid policies, as we discussed before. And what are the controversial issues in political climate? The controversial issues would be that some patients not having the appropriate access to prescriptions they need but do not reach the requirements. So that means that they're just not able to get the opioid prescriptions they need. And for political climate, again, Democrats seem to advocate more on the concern of the opioid crisis. And then our policy 3, which is the Opioid Education Act. What's the debate? So the debate is there needs to be more opioid education in public and private schools. Which population does this affect? This affects school-age children because that is who the education is for, and those that are certified to teach this course. School-age children should be taught this material so they can make appropriate decisions as adults. Who's against it, who stands to gain from it, and who stands to lose? No information on who's against this policy or who would stand to lose, as there are no risks or penalties other than taking the time to educate this topic. And who stands to gain would be the future generation of children. The lobbying strength lies with the federal government to fund this education, and there's no information on controversy for this policy nor a stance on political climate because it's just giving education to children. So we found that our top recommended policy, although we all feel that these are important policies to implement, we feel that policy 3, the Opioid Education Act, is our top policy. We found that this is the best policy solution because this is a primary level of prevention. This policy will impact our problem by the future generations having more awareness of opioid addictions and how to make better choices regarding those drugs. Some unintended consequence that might be anticipated are that we will have to carve out school time in order to implement this policy. This policy will impact the public good by all children having an awareness of opioid drugs, their use independence, and how to make appropriate decisions when they become an adult. And this policy would be a nonprofit organization with little funding from the federal government. So we just think that would be the best one to recommend. So what's next? The challenge and next steps to this policy would be getting the government to fund an opioid education program as well as hiring qualified people to teach the course. Both political parties should be in support of this policy because both acknowledge the crisis at hand of the opioid epidemic. And here are our references, so thank y'all so much.